Hello parents, welcome to our special Q&A session. Parenting is a wonderful experience, especially for first-time parents. But with new experiences come new questions. This is where we come in to help you and answer all the questions that may come into your mind regarding the health and well-being of your newborn, your babies and mothers by bringing in the experts. With winters fast approaching, many mothers to be, and babies may be affected by skin issues because of the dry weather. For this, we have with us today Dr. Shuchi Singla, who is a dermatologist with 12 years of experience. She will help keep your winter worries at bay and help you look your ravishing best during the festive season. Welcome to our session, Doctor. Dr. Shuchi Singla is a leading name in the field of dermatology. She is currently practicing in Max Hospital, Gurgaon, and also has her own clinic. She was recently awarded the prestigious Professor V.N. Sehgal Award for Excellence in the field of dermatology. She also has many publications in both national and international journals and has been invited as a speaker at both national and international platforms. In this session, we have many questions by our followers regarding skin issues, and Dr. Singla will help answering them. So let's get started and take up your questions. The first question has come in from Priya. She says, it seems my baby has got an allergy and it seems hereditary because Priya also has this allergy. She's saying, what is the cure in childhood and what must I do to get my baby's skin used to this environment?
I wish the question has been more specific. Well, infants and children are very prone to allergies of all kinds, especially the infants who have a dry skin in which the integument or the outer layer of the skin is less developed as compared to other kids. And if the parents are a carrier of allergy, it is a source of allergy to the future generations, which is transmitted hereditary from one generation to the other. Now, there could be many causes of allergy in kids. Maybe it is the cloth fabric which is causing the allergy. And then there are certain foodstuffs which are more prone to cause allergies, like it could be nuts, soya beans, non-veg, fish. Certain food items cause more allergies. But I think without knowing and seeing the nature of allergy on the body of your child, it is difficult to figure out what exactly the allergy is and what cure can be given to the child, but a mild steroid cream is what we generally prescribe for all kinds of allergies in
But
kids.
should Priya go in for some testing before even going for a steroid cream?
See, the tests for allergies are not very specific and sensitive, but yes, we have a comprehensive allergy panel test which can be done to figure out what exactly is causing the allergy, and the test has to be corroborated with the history of the mother to say if the particular thing is causing the allergy in the infant or the child.
All right. Our next question has come in from Sadhna. Sadhna says her baby is just 4 weeks old. There is flaky skin on her head. Should I scrub it off or is there anything else that I must do to manage this?
Very good question. So many parents come to me with this query in the OPDs. Flaky skin on the scalp of an infant is a very common occurrence affecting almost 80% of all the infants. It is also called cradle cap. The most important message for the viewers is that please don't be panicky about it, don't be frightened. It is a very physiological condition which occurs under the influence of maternal hormones, leading to excessive production of sebum by the oil glands, leading to flaking of the skin. And you said rubbing the skin. No, not at all. The infant has a very sensitive skin. Kindly do not rub the skin off. It will lead to bleeding and all kinds of erosions on the scalp of the child. What we generally prescribe is take a small amount of any warm oil, be it coconut oil or olive oil, put it overnight and wash the head off the next day, so the flaky skin kind of loosens off and falls off on its own. No other medical treatment is required per se.
And this will resolve on its own.
On its own.
All right. The next question has come in from Ruchi. She says, my baby was recently diagnosed with hand and foot disease. I want to know what causes it so that it can be prevented later.
Again, a very common childhood problem. It's caused by a virus wherein you get small blisters on your hands and feet and some oral ulcers which interfere with feeding and drinking. The disease is transmitted from one person to the other, like an infected child transmits the disease to the other healthy kids, especially in daycare, schools, and even if you have more than one sibling at home. So, the disease can be transmitted by means of fomites, by sharing of common clothes, utensils, toys, or anything that is infected from one person to the other. But the good news is that once the child has the disease, he or she gets lifelong long immunity from the virus, and the disease does not recur in future.
Right. But in a viral infection, what is the treatment? Is there any specific medicine? What can be done?
Well, unfortunately, there's no specific treatment for hand, foot, and mouth disease. As it is, these lesions on the hands and foot are symptomless, so nothing is required for them specifically. For the oral erosions, we generally prescribe an anesthetic gel to soothe the infant and make the feeding easier.
All right. We have next a question from Smriti. She says, my toddler frequently gets dandruff. What is a good treatment for this?
Well, I would like to say dandruff is not such a common problem in toddlers since the oil glands which cause dandruff are not developed until puberty. So, labeling it as dandruff and just getting away with it is not the solution. I think you must take your child to a skin specialist and get the flaky skin on the scalp of your child evaluated. There could be a couple of causes which cause dandruff, like most common is lice infestation. Many kids get lice during childhood from schools or daycares, and repeated scratching can lead to flaking of the skin on the scalp. So, that could be one cause. The other cause could be childhood psoriasis. Psoriasis is an inflammatory condition that can lead to flaking of skin on the scalp. Uh, Apart from this, any kind of eczema in childhood can lead to flaking of skin. So make sure you've ruled out all these causes before labeling it as dandruff and just getting away with it. If at all it is dandruff only, any over-the-counter antifungal shampoo would do the trick and help the child be treated of it.
But you would recommend getting it tested before
Yes,
going for this
definitely
shampoo.
see a specialist before labeling it as dandruff only, right?
Right. The next question is coming from Sony. She says, what are the good treatment for sunburns in toddlers? Children go out and play, and overexposure to sun can sometimes hurt their sensitive skin. What would you recommend?
I agree. See, for sunburns, be it adults or kids, I always say prevention is better than cure. Before the thing happens, please take some measures which prevent sunburn in toddlers. If at all the sunburn has happened, you can use cold compresses on the area and use a mild steroid or a moisturizing cream twice a day for a few days that heals the condition.
Okay. Cold compress and a moisturizing cream or a very mild steroid cream. Monica says, how to prevent rashes in skin folds? Are there some home remedies for it? Perhaps she's talking of, something which is like a fungal problem.
Right.
Because in a skin folds, sweat gets trapped and
Right,
then, you have all sorts of, white skin and itching and something which is like a fungal infection.
Yeah, completely agree. Rashes in skin folds is a very common problem in infants and kids, mainly in areas like under the chin, in the armpits, and in the groins. And as you rightly said, the most important factor leading to rashes is entrapment of moisture in these areas. The best way to prevent the rashes in the skin folds is to keep the area clean and dry. A very good hygiene of the child is very important to prevent the rashes in the skin folds. So, the most important precaution is change the child as soon as it is the child spoils or soils the clothes. Wear loose fitting cotton clothes. Change the diapers as soon as they're required, and you can use a antifungal powder twice to thrice a day to keep the area dry and prevent skin rashes.
Any home remedies for this?
Just keep the area clean and dry. Keep it open in the air for some time before putting the clothes on the infant, and use the antifungal powders to keep it dry.
All right. Mamta asks, my baby is 6 months old and has very dry skin. Is this normal? How to treat it?
See, dry skin in infants is a common problem affecting almost 10% of all the kids. In some kids, the outer layer of the skin or the integument is less developed as compared to others, and the sebaceous and the sweat glands that provide hydration to the skin are also less developed. So, such patients have a dry skin which persists for few years in childhood. And as far as the treatment is concerned, obviously since the outer layer of skin is less developed, the lipids and the oil glands are lacking, you have to substitute the thing from outside. So external hydration from outside is the key and has to be practiced for a few years to keep the problem at bay. Uh, Liberal moisturization 2 to 3 times a day, once immediately after bath when the skin is still moist, as it entraps the moisture, is very important. Certain other measures which you should take is, do not keep the infant in water for a long time, as it takes out the moisture
Dehydrates.
from the skin. Do not use very hot water for bath. Do not use any harsh soaps on the body of the child. Certain other precautions you should follow.
I have a follow up question here. Is a moisturizer better or less effective than oils? Plus, we also keep our children in air conditioned environment, which also dehydrates the skin. So how can you moisturize the skin after a bath, but how do you create a layer on it so that the moisture is trapped instead of
See, there are
being
two
released into the
right.
environment?
Two things need to be taken care. Firstly, you moisturize the skin immediately after bath. Let it be slightly moist when you put a moisturizer on the skin. That kinds of entraps the moisture inside the skin. The other is use a very good moisturizer. Like infants who have a very dry skin, look for ingredients like colloidal oatmeal or ceramides that replenish the barrier of the skin and provide long-term hydration to the skin.
All right. Usha is asking, how do I know if my baby is allergic to some fabric? Is this common, allergy to fabric?
Allergy to fabrics is not a very common problem but can occur in infants who have this dry kind of skin, who are prone to allergies. And the commonest fabrics would be something like nylon or something non-cotton would cause allergy,
Which is not natural.
which is not natural. We generally ask the parents to put cotton clothes on their kids and not any other fabric to prevent allergies. And what you see as an allergy would be a red, itchy, oozy skin, which will be a sign that the infant is prone to allergies.
All right. Neelam has sent a question. She says, my baby is 4 months old and has patches of dry skin all over her body. How to treat this? It's not like full dry skin, but patches of dry skin.
See, again, liberal moisturization all over the body is the key. With a good moisturizer or good old coconut oil, I say, is a good moisturizer to moisturize the body. If the patches are really bad, a mild steroid cream for a few days can improve the patches. Plus, please don't make it a habit to put the steroid cream again and again. Don't take it as an alternative to putting moisturizer on the body of a child, because I see parents, we give them prescriptions and they put the steroid for a few days and forget about the moisturization. So moisturization has to be followed long term to prevent the patches from occurring again and again.
Right. Nishi is asking, can my baby get acne? Can it be treated at home? Maybe Nishi has seen some boils or eruptions that look like acne. Are babies prone to acne?
Yes, babies do get acne. Both infants as well as children are prone to acne. These days, as it is the age of puberty has preponed a lot, so kids as young as 7 to 8 years old are getting acne. So there are certain precautions you need to take in the skin of such a child who is prone to acne. Use a mild face wash to wash the skin twice a day to cleanse all the dirt and dust which is there on the skin, which clogs the pore and causes acne. Do not rub your skin too much, which again irritates the skin and causes acne. Do not put a exclusive moisturizer on the skin, which again clogs the pores and causes acne. And if at all it has occurred, I would strictly advise to refrain from using any kind of home remedies. Like some people use lemon, tea tree oil and raw aloe vera on the skin, and we've seen all kinds of eruptions with this type of stuff using on the face. So kindly see a dermatologist and get a prescription. They generally prescribe you a topical anti-acne medicine containing a retinoid or a benzoyl peroxide based preparation, which will help improve your child's acne.
All right. Shweta is asking, what is meningitis rash and what are the symptoms?
Good question, though an uncommon problem, but a really fatal one. Meningitis, as we understand, is the inflammation or infection of the meninges caused by either a virus or a bacteria. When we talk of kids, it is the bacteria which is the commoner culprit than the viruses, and the most common is meningococcal meningitis. What you see in the child is a high grade fever along with signs like headache, nausea, vomiting, delirium, confusion. the child is unable to see properly, and there will be neck stiffness, which is a classical sign of meningitis. On the skin, there's a classical rash, which is like a pink, red, or purple rash, which is initially pinpoint and then becomes blotchy or patches on the skin of the child. And how to make out if it is a meningitis rash? You take a glass tumbler and press it firmly against the rash. You'll see the rash more clearly through the glass tumbler. If you see any kinds of such signs in the child, please take him straight to the hospital and see a specialist. It is a real emergency which needs to be treated at the earliest.
Is there a way to prevent it? Because I think there is a vaccine. Right?
Vaccines are there, and all the kids have to vaccinated against the meningitis.
At what age?
Before 2 years of
Before
age.
2
It is
years.
there in the program as well.
All right. Ragini is asking, my baby is a year old and recently got ringworm. How can I treat it?
Good you ask this question. We are actually dealing with a ringworm epidemic these days. Every third person is getting ringworm, and it is forming almost 50% of the patients of our OPDs. And kids are not spared, definitely not. If a young child gets a ringworm, we generally give a topical antifungal medicine, but these days we prescribe it for 3 to 4 weeks at least, so that the infection goes off and does not come back. And the most important precaution is, please screen all the household contacts if they have similar infection and treat them. Otherwise, it becomes a vicious circle, going from one person to the other again and again.
But what causes ringworm?
Ringworm is caused by a fungus. It is a fungal infection.
And you would bring it on if you do not practice hygiene. What would bring it on? I mean, how could you prevent it?
Good hygiene is definitely important. Changing your clothes twice a day, washing them, putting them out in the sun. Proper washing of bed sheets, covering sheets, towels, etc. is very important. And please avoid using of public loos, public pools, etc. is important to prevent further infections.
All right. So, Dr. Singla is saying that this is becoming very common. So, please take precautions of hygiene. And if any family member has got it, make sure that their personal items are cleaned properly so that it doesn't spread to the rest of the members. We've got a question coming in from Rita. She says, my baby is 8 months old and has small white spots on some part of his body. How do I treat them? What are these white spots?
Difficult to say without saying. 8-month-old child with white spots could have a couple of diseases. Without seeing exactly what the white spots are, difficult to answer what to do for it. Few of the causes could be simply dry skin can cause white spots on the body.
Okay.
Or you could be dealing with something like vitiligo, which is leukoderma, or milky white spots all over the body. Certain genetic disorders also cause like decreased pigmentation on certain areas, which is called mosaicism. So without seeing the child, it's difficult to say what the white spots are. Please take your child to a specialist and get him clinically tested. And we have an instrument called dermoscope, which is very useful and handy in diagnosing what kind of white spots you have. It is a non-invasive thing. We don't have to cut or do anything to the child, and we can diagnose what exactly the white spot is.
Sometimes there is a belief that because of nutritional deficiencies you have white spot. Is it true?
Absolutely false. The many mummies come to me with saying कि मेरे बच्चे को white spots हो रहे हैं. Is it calcium deficiency? And we simply explain to them that no nutritional deficiency causes white spots. So there are certain other causes which are need to be looked into and treated accordingly.
All right. Seema is asking, can infants get eczema and is it treatable?
Yes, why not? Infants are very prone to eczema, especially so who have a dry skin. And so again, I tell you again and again that moisturization of the skin is utmost important to prevent allergies in infants. And cotton based fabrics are what we generally prescribe to the kids to prevent allergies from fabrics and all. And treating the eczemas as and when they happen with mild creams is what is generally recommended.
But it is just dryness, or is it a condition that needs treatment? How should one view eczema?
Eczema generally would present as a red skin with itching, blisters, oozing on the skin. So if you see such a condition, please take your child to a specialist to get it diagnosed correctly and treat it. Don't try to treat at home. If they are simply white patches, please try and put a moisturizer and see for a few days if it improves. If it doesn't, please take him to a specialist.
So we have 2 questions coming in. They're similar, so I'll take it together. Geeta is asking how to protect baby against sunburns, and Shivangi is asking what are the precautions that we should take for baby when going out in the sun. So, if you can
Right,
address sunburn and
absolutely.
precautions.
Toddlers and kids have a thin, sensitive skin, so they are more prone to all kinds of environmental insults, be it heat, cold, or environmental pollutants. And sunburn is definitely a problem in kids. So there are certain precautions which you need to take while you take your child out in the sun. The most important being avoid going out in the peak sunlight hours, that is between 10 a.m. to 4 p.m. when the UV lights are at its peak. If at all you have to take the child out, please dress up your child with full sleeved clothes which cover most of the body surface area of the child with a tightly woven fabric and preferably slightly darker colors which prevent the UV lights from being
Being
incident
absorbed.
on the skin. Additionally, try to use a hat and sunglasses to protect these areas like face, ears, neck, etc. And a good sun protection cream with a SPF of at least 30 plus should be additionally put even on the covered parts to give additional protection.
Okay.
And the sunscreen should be put at least 30 minutes before you step out in the sun.
30 minutes
Before
before
you
you
step
step
out in
out.
the sun.
And for sunburns, you said a cold compress with
Cold
good
compress with a
moisturizer.
good moisturizer.
Right. Aarti is asking, what additional things should I do in winters to prevent skin diseases in my baby?
Right. So in the cold weather, again, since the cold, dry weather sucks out the moisture from the baby's skin, liberal moisturization has to be practiced throughout the winters, 2 to 3 times a day, immediately after bath. Do not do not bathe your kids in very hot water, which dries out the skin. Do not keep them in water for a long time, and moisturize the skin as much as possible.
All right.
Right.
Rachna is asking, should oiling be done before or after bath?
Very common question we face in the OPDs. So it actually depends on a couple of factors. First, the most important is the skin condition of your child. If your child has a dry skin, you obviously would want you to moisturize and oil the skin after bath. Since if you oil the skin and bathe your child, the oil would be just
Washed
washed
off.
off. So oiling or moisturization of the skin immediately after bath in case your child has a dry skin. Then it depends on the kind of oil you're using. In some communities there's a tradition of using mustard oil for massage on the baby's skin. And
Especially in winters,
in
it's supposed to be
winters,
warm.
but mustard oil is a potent irritant and it can harm the baby's skin. So in case you want to use mustard oil to massage your child, please do it so before bath so that the oil is washed off once
Okay.
you bathe the child. You can use light oils like coconut oil or olive oils post bath, but not mustard oil.
Right.
Right.
Some mothers, especially in Punjab, also consider ghee as a good option for massage.
Again, ghee can be used for massaging, but again, before bath, we don't want that heavy fats to be there on the child's body after bath, especially in hot and humid weather.
All right. Kavita is asking, what should I look for while buying moisturizer for baby? Perhaps why this question is coming because there are preservatives in many of these moisturizers, so
I know.
some mothers get concerned. What would you recommend?
I really understand there's a plethora of products available in the market, and any mother would get confused what to buy for their babies. So, there are certain things which you should look at while buying a moisturizer for your child. Uh, the child's skin is very sensitive and thin, so it is more prone to effects of irritants, which is not so in adults. So there are certain things which should not be there in a baby moisturizer. Please look for the look if there are any kind of parabens or perfumes or fragrance. Please do not buy the product. Polyethylene glycol and propylene glycols are other additives which are put in the moisturizers to enhance their efficacy. So please do not buy products which contain all these ingredients. My advice would be to buy a product which contains the least ingredients and known things like something like paraffin, shea butter, cocoa butter are certain common ingredients used in the moisturizer which should be there.
Priya is asking, is there any special care that can be taken to prevent dry lips in toddlers?
See, what causes dry lips in toddlers is more important than treating them. It is the hot, dry weather which causes dry lips, and then the harsh winters. And some kids have a habit of smacking or licking their lips all the time, which causes dry lips. So these problems need to be addressed. And if at all it happens, take a petroleum based cream or a simple Vaseline petroleum jelly 2 to 3 times a day, which reduces the problem.
Sheetal is asking, I'm 6 months pregnant and I'm losing a lot of hair these days. Is there any remedy?
See, hair loss in pregnancy is not such a common problem we encounter. In fact, pregnant women have thick, lustrous hair because of the influence of maternal hormones, and the hair is actually lost after delivery. But in case the hair loss occurs, there are certain causes which need to be looked at. The most important is firstly look at your nutritional status. Pregnancy, as we know, is a high demand state, and excessive nutrients are required to meet the demands of the growing fetus. So make sure you are taking a balanced diet with the excess of nutrients along with your daily doses of iron, calcium, and vitamin D to make up the losses. Otherwise, you can have hair loss.
Okay.
The other important cause could be thyroid disease, which can lead to hair loss even in non-pregnant women also. So make sure your obstetrician has tested you for that and treated you accordingly.
All right. Kusum is asking, I'm in my third trimester and I have back acne. How can I treat it to reduce the itchiness? I mean, this is quite uncomfortable. In any case, uncomfortable in the third trimester.
Acne can happen in pregnancy under the influence of hormones. But unfortunately, since the woman is pregnant, we cannot give her much medications to take care of that acne. Home measures and certain precautions she can take to prevent and soothe their skin, like wear loose fitting cotton clothes, avoid humid weather, be in an air conditioned environment. At max, what you can do is use a topical anti acne cream based on clindamycin or benzoyl peroxide, which is safe to be used in pregnancy. And you can use a safe antihistamine like cetirizine or loratadine to take care of the itchiness.
All right.
But no antibiotics in pregnancy.
Thank you so much, Dr. Singla, for coming for this session. With this, we have come to the end of the session. I hope you have enjoyed the session and got a lot of your questions answered. This information, of course, will be priceless for those moms and babies that are having some skin-related issues. We would like to thank Dr. Shuchi for her time and also sharing her expertise and knowledge with us. Hope you enjoyed the Q&A session. Stay tuned for more updates in our next session.